All right, good afternoon, everyone.
Good afternoon.
Thank you for joining us. It is so good always to be surrounded by what I consider to be movement family. I'm immensely proud to be partnering with Color of Change as we demand that Republicans take their hands off our health care, hands off our food assistance, and hands off other essential life-saving programs. Thank you to Portia for standing at the gap for such a time as this. Thank you for the indefatigable efforts of the entire team at Color of Change, to the folks here today who are opening their hearts to share their stories with us all. And thank you to my colleagues, Representatives Lee, Brown, Adams, Amo, and Tlaib for their partnership, and to our friends at Families Over Billionaires for the work you do each and every day. We stand here today because Republicans are trying to gut Medicaid, SNAP, and other essential life-saving programs so they can line the pockets of billionaires, including Elon Musk and Donald Trump. Donald Trump is stealing from the poor, the elderly, the vulnerable, and everyday working families to line his own damn pockets. This is the great Republican ripoff. These attacks are precise, intentional, targeted. They mean harm to everyone who calls this country home, beginning with our most vulnerable. They're coming for our veterans, our elders, and folks with disabilities. They're coming for those in need of life-saving medications for chronic diseases like asthma, high blood pressure, and dementia. They're coming for babies who need formula, parents who are just trying to put food on the dinner table, and of course, they mean to harm our black and brown communities who stand to be the most impacted by these devastating cuts. Medicaid is essential health care. About 1 in 5 Medicaid enrollees are black. SNAP is essential food for families. 20% of black households have faced food insecurity in recent years, compared to 7% of white households. As the saying goes, when the rest of America gets a cold, black folks get pneumonia. And this bill is certainly a testament to that. I represent the Massachusetts 7th, a district that is vibrant, diverse, dynamic, one of the most unequal in this country, and was hardest hit, one of the hardest hit congressional districts by the first Trump occupancy. And we have every reason to believe that this will be the case again in the second occupancy of the Trump White House. Donald Trump was up here today threatening his caucus to fall in line behind his one big, beautiful bill. Donald, there is nothing beautiful about making people sicker, making people poorer, making people more vulnerable, and that's exactly what this bill would do. Nearly 14 million people kicked off their health care. Food ripped out of the mouths of millions of children, seniors, veterans, and folks with disabilities. I mean, seriously, the only people who benefit from this bill are toy spaceship billionaires like Elon Musk and Donald Trump himself. The cruelty is the point. Republicans know exactly how cruel and unpopular this bill is. Otherwise, they wouldn't be trying to move it forward under the cover of night at 11 o'clock on a Sunday or 1 a.m. on a Wednesday like they're doing this week. You know, Donald Trump and Republicans would love for us to stop fighting back. Donald Trump's a dictator. A dictator wants a citizenry that is ignorant and uninformed, that is indifferent to the suffering of its neighbor, and that is inactive. They would love for us to see this dark dystopian vision that Donald Trump has for America as an inevitability, but it is not. And the only way to beat a dictator is with defiance. Our colleagues in the House across the aisle, you know, I'm asked all the time if there are opportunities for bipartisanship, to which I respond, where is the party for bipartisanship? This is just a cult of cowards who've been complicit in wholesale harm. Just a cult of cowards. This MAGA cult is also a movement. And the only way to beat a movement is with a movement. And the only way to beat a dictator is with defiance. So that's what brings us here today. We won't back down, not for a second. And Medicaid, SNAP, Head Start, and the VA, these programs aren't just line items in a budget. They are lifelines. They are lifelines. Policies determine who lives, who dies, who survives, who thrives. So together we say, hands off health care, hands off our food, hands off our bodies. And with that, I will now turn the mic over to our leader here, Portia Allen Kyle from Color of Change.
Good afternoon, everyone, and thank you all for being here with us this afternoon. For those who don't know, my name is Portia Allen Kyle. I have the honor of leading Color of Change and being here in community with all of these beautiful folks who have showed up to say absolutely not to this bill that is all about taking health care from our seniors and from those who are most in need, taking food from our children, all to create a class of trillionaires who are unsatisfied with their billions. And we know money can't buy happiness, because if money bought happiness, then the richest man wouldn't be trying to buy a country. And so the attacks that we are under, we know are devastating for black and brown families. We know that they are devastating for working class families. Black children are nearly 3 times more likely to experience hunger than white children. 22% of black children live in food insecure households. With the costs going up, with wages remaining the same and going down, taking away these vital government services are taking away the ability to survive. When it comes to opportunities for education, we know that education has been such a pathway to progress for black and brown families. And so attacks on student and federal financial aid, attacks on Pell Grants, are attacks on our mobility and our opportunity, not just for us, but for our generations to come. And so as we're thinking about the magnitude of the proposed cuts, the unprecedented nature, the extent to which they are willing to go to further this neo-segregationist agenda that seeks to consolidate power and consolidate wealth for the most havingest of the haves at the expense of everybody else, that's why we're here on the Hill today. That is why our members are here and have joined us, that we are joined with family, with those who have been in the fight with us, who will continue to be in the fight and represent us and for us. And we're here to remind people that our families are not just a line item. We are not just a line on a bill. Our families are the nurses, are the teachers, are the students, are the parents that are the backbones of our community. And so we ask, it's time to cut the greed and not the people. Right. Again, it is time to cut the greed from this bill and not the people. And so while they are so concerned, those members of the House Republican caucus, on waste, fraud, and abuse, we are concerned with greed, theft, and corruption. That is at the center of this bill. Yes. And so we stand here united and unanimous in opposition to all of the ways they are trying to undercut our livelihoods, and we thank you and appreciate everyone coming out today. And I turn it over to the wonderful Congresswoman from Pennsylvania, Summer Lee.
Yes. One of my favorite truth tellers.
You set the standard high. Good afternoon, everybody. I'm Summer Lee, Congresswoman for the 12th Congressional District in Pennsylvania, so Pittsburgh and Western Pennsylvania, and I stand with them. I stand with all of you, our advocates from all over this country, and I thank you so much for being here with your moral clarity, being here despite your graduations, because we know how pressing this moment is. And I'll say that it's a sad state of affair when working class folks, not just here at the press conference, but all over this country, have to take to the Capitol or take to the streets back home to urge their representatives not to cut critical access to health care or food assistance or education and so much more. But all over the country, Americans are speaking out against Trump and against MAGA efforts to take from the poor, from the sick, the disabled, the hungry, the unhoused, to give to the billionaire. The oligarchy is alive. It is alive and well in the White House, in the Congress, and they didn't waste a second to come for you. Right now, as we speak, they're planning their tax cuts for billionaires and the ultra wealthy donors. These are trillion-dollar cuts we're talking about. In this reconciliation proposal, Republicans are providing an estimated $7 trillion in giveaways to the ultra-wealthy and billionaires, while working families struggle to afford their basic needs: housing, food, gas, eggs. Republicans keep talking about America first, but I haven't seen a Republican put anybody who makes under $100 million first in any of the proposals or policies that I've seen. go through. These reconciliation proposals are some of the cruelest ones yet. America first. Meanwhile, they're making the largest cuts to Medicaid in history after they swore they wouldn't touch it. Millions rely on Medicaid, 165,000 in my district. These are parents caring for their children with cancer, elders who need support in nursing homes, folks with disabilities. Republicans say America first, but they're cutting food assistance like SNAP, the very lifeline that feeds folks struggling to make ends meet. In one of the wealthiest countries in the world, we have people experiencing hunger and homelessness who rely on assistance. And rather than provide these folks with fair wages and affordable housing, Republicans are cutting the very benefits and social services in favor of these oligarchs. They're cutting people out of jobs, cutting their access to higher education. The reality is, these oligarchs who've bought their way into the Oval Office have already taken so much from working families. That is exactly why we have to get money out of politics, because when Republicans are more accountable to the corporate interests and the billionaires and lobbyists lining their pockets, we've lost the plot. We've lost democracy. This is now about who has power and who they are willing to hurt to keep it. And it's working families and the disenfranchised black and brown communities that get hit the hardest every time. Trump calls it the big, beautiful bill. But tell me again, what is beautiful? What is beautiful about forcing families to choose between taking their kids to the doctor or feeding them? Let's be clear. It would take just 3 Republicans, 3 of them, to block this egregious bill when it comes to the floor. Will any of these Republicans have the courage to stand and put America first? Every single person in this country should be pressuring their representatives to vote no. Because even if you aren't on Medicaid or SNAP, every person who is not as rich as the folks Republicans are pandering to will be impacted. So know this. I will never vote for a budget that comes at the cost of our people, of their health care, of their education, of their lives. And I will push back against every effort to do so. And we would like Republicans to do so as well. With that said, I would be honored to bring up Representative Shantel Brown from Ohio.
Thank you. I am honored to be here with Congresswoman Pressley, Congresswoman Lee, and advocates from Color of Change and Families Over Billionaires. We're here to sound the alarm. We're here to speak up and to speak out. House Republicans are trying to make life worse for millions of people, and they're trying to do it in the blink of an eye. If this legislation passes, tens of millions of people would lose their health care. If this legislation passes, it's just not a bad bill, because we've seen bad bills. This is the most deliberately destructive legislation Congress has considered in decades. And there's not a lot of nuance or complication here. Trump and MAGA extremists in Congress are taking money from our constituents and giving it to their friends and donors. In my state of Ohio, the state government has already said that if these cuts are enacted under state law, they will end the Affordable Care Act Medicaid expansion in our state. So what does that mean? Well, I'm glad you asked. It means 770,000 people will lose their health care. That's an entire congressional district in just one state. This is suffering on a massive scale, and it's going to hurt people of all backgrounds. But it's going to be especially destructive in black and brown communities. Approximately 38% of the people I represent are on Medicaid. 21% are on SNAP. Donald Trump has raised prices. He's defunded their neighborhoods. He's attacked their relatives who work for the federal government. He's bullied the private sector into abandoning diversity programs. And now he wants to take away their food and health care. This is callous and cruel, and it is intentional. These are people that have been locked out of wealth, locked out of good wages, locked out of education and health care access for generations. They've been locked out by the structural racism that's oppressed our community for decades. For a lot of people, the health care they've received from the Affordable Care Act has been life-changing. And now, Donald Trump and his allies want to take it away. And we are going to fight this with everything we have. You better believe that. Yes. So it is now. my honor and my pleasure to bring up the gentle lady from Michigan's 12th District, none other than Miss Rashida Tlaib.
Thank you, Shantel. Thank you so much to Color Change. I can tell you they have been grassroots on the ground, not only in my district but across the country, motivating, just a generation to kind of continue to speak truth to power. So I thank them so much. I love to start with the fact that I was born and raised in the most beautiful, blackest city in the country, the city of Detroit, where the community mothers have taught me from day one that it isn't transformative change doesn't come from that building behind us, but from the streets when we make that building move, that institution move with us in regards to what we need to see in our communities. Right now, many of my colleagues, Republican colleagues, are saying they're not cutting Medicaid. Have you heard that?
Yep.
We're not cutting Medicaid. Mother, I know they're lying, but people out there, I said, well, nonpartisan groups and organizations are saying that they're cutting him. This kind of misleading, gaslighting, whatever you want to call it, straight up we ain't doing it. Yeah, it's a lie. It's a lie. You're going to cut long-term care from your seniors. You do, you're going to literally rip away coverage of mothers who just gave birth for postnatal, postpartum. You can ask anybody right now, what does nearly $1 trillion cut do for our communities in regards to Medicaid? They will tell you it will be completely life-changing. We are going to see people's lives either lost, completely deteriorated. I mean, this is ridiculous. The fact that I continue to hear my colleagues say, we're not cutting Medicaid. Yes, you are. And don't take it from us. Look at the data from the Congressional Budget Office. Stop lying to the American people. The many families in my district, many of them black and brown communities throughout the nation, we know this, have already struggled, right? We're always the one communities that always gets left behind. You talk about environmental racism? Check. They're right in our backyard, polluting our community, making us sicker, making our community sicker. And they're like, well, let's come Medicaid too. In my district, over 40% of births are covered by Medicaid. Over 40%. The national crisis on black maternal health is real, y'all. I've talked to grandmothers, mothers, fathers, everyone who tell me that they're losing their loved one, losing a mother because of complications. But go ahead, let's just rip the Band-Aid off, because it is a Band-Aid. Medicaid's a Band-Aid. It is a Band-Aid because we know corporate greed within our healthcare system is the problem, and we got to root that out. That systemic racism within our healthcare system is the problem. We got to root that out. But Medicaid, you're going to rip the Band-Aid. You're going to say, nah, we don't care. These are the same people that come and talk to me about life, talk to me about children. I have an infant mortality crisis in my community. Cutting Medicaid, you just don't want to see these kids reach the age of 1.
Speak on it.
This is what the real impact will be. And I've already heard from the clinics in my community, the hospitals, all these folks that continue to tell me, Congresswoman, you don't understand. If you cut this, we're going to have to close doors. How many of us have heard that?
Yeah, so much.
And so it is important to know this. But ask why. Why are they doing this? It's not millions or billions, but $7 trillion. I looked it up. I looked up who wasn't paying federal taxes, because Ayanna, I got to look it up. So I just want to no. DTE. Do you know who DTE is in my community? It's the utility company, private utility company, who by the way, they didn't pay federal income tax for what? Well, let me see, 1, 2, 3 years. Federal income tax. You hear my Representative Adams? They haven't paid federal income tax. That's who's good. Girl, you come in my district, they probably join you. But they just asked for an 11% increase, and they don't even pay federal income tax. T-Mobile didn't pay federal income tax. Penske, yes. FedEx. How many of y'all paid federal income tax? You know it. And I look at all of this. I look at all of them. Amazon, Target, Walt Disney, PepsiCo, Facebook. Representative Adams. Now, they got a different tax giveaway. They label them differently. But think about that. They are putting these corporations before our people and before their own people. One of my colleagues has 62% of his community relies on Medicaid. But he's out there pressing the button. He's going to do it a third time and say, I'm not cutting it. But we're here to speak the truth. Our communities are on the front line. And it breaks my heart because I know they're going to be the first to die. They already always are because of these broken systems. And cutting Medicaid is just going to be devastating. I'm already hearing it. My mothers with special needs children tell me, what am I going to do, Rashida? This is how I get wraparound services.
Right.
You know, I keep thinking about the fact that 60% of nursing home stays across our country are covered by Medicaid. I keep thinking about, you know, the mothers who give birth and take their kids to see a doctor when they get sick. And you think about all those, and those children are all uninsured or underinsured, and it's Medicaid. That's the lifeline for many of them. So I say to all of you and continue, and you know, many of the advocates understand this. This is a crisis. This is where we need to move with urgency. And so I really appreciate Representative Pressley bringing us all together. But on behalf of the community I represent, you know, we understand what it means to speak the truth. But resistance can only come from the streets. And what I mean by that is we got to organize outside and show people in these communities that they're a member of Congress. And there's one in Detroit, in the Detroit Metro Detroit area, Congressman John James, who his district relies heavily on Medicaid. But he's in there and saying, no, I got the backs of my community. And this person wants to be governor. Now, I know, Representative Adams, I can tell you right now, Macomb County, Oakland County, where he represents those families, I've met them because they refused to do a town hall. So I said, well, I'll come and answer the questions. And I did, and there is nobody in that room that did not shed a tear, because to me, Medicaid and SNAP, they're nonpartisan. They feed people that are hungry, no matter their political affiliation. They cover people. Medicaid does it without political affiliation. It's a nonpartisan issue. If anything, it's a human being issue. These are human beings that were devastating, all because we want all these corporations and all these billionaires and folks getting these $7 trillion cut. But don't worry. They did have an increase in the budget. You know what it was for? The Department of Defense. They increased it by, what, $6 billion? So don't worry. They have money for bombs and wars. But they don't have money for Medicaid and SNAP benefits for our residents. You know, and it's devastating because the Pentagon budget hasn't passed 7 audits in a row. You talk about waste and efficiency. You can see it's our communities that are always going to be on the front line. They always seem to have money for that, but not clean water, not tackling on the issue of black maternal health, tackling on the issue of poverty in our communities. And so I thank you all for so much for coming here and putting the mirror up at them and understanding that they're the problem, and again, denying that they're even doing it is disgusting. With that, I have my neighbor in the Rayburn building is Representative Adams. So much grace. I wish I had the grace that you have, Representative Adams. I can't. You do it so beautifully done. Oh, no. But, you know, she has been fighting on behalf of her communities for a long time. And, you know, I just want you to know she is a community mother, hands down. She takes care of her community, and I'm so proud that she's here. And with that, everybody give her a warm welcome.
Thank you, my neighbor. Listen, color of change, we're going to change some things. It's still about PPP here, you know, punishing poor people. But we're going to change some things. Let me just be perfectly clear. People will die if Republicans succeed in cutting Medicaid and SNAP in their budget bill. It's not a hypothetical. It is not a theory. It is fact. And so American citizens will lose their lives so Republicans can fund their GOP tax scam. And nearly 14 million people will lose their health care under these proposed cuts, including 650,000 North Carolinians who are covered under Medicaid expansion. Millions more will go hungry at a time when nearly half of the households in America are living paycheck to paycheck to struggle to make the ends meet. You know, working hard is not enough if you don't make enough. You know, it's reckless, it's cruel, and it's unacceptable. And Republicans, shame on you. You know, I think about how these cuts are going to harm our kids. Nearly half of all of our children in the U.S. get their health care coverage from Medicaid or CHIP, including 99% of children in foster care. And that's what we're here to talk about. All of my colleagues and and all of the advocates who have come. 42% of all SNAP recipients are children, helping to pull millions of our kids out of poverty every year. And these cuts will cause our children to go to bed hungry every night. It's going to strip away their ability to get help when they're sick or injured. It will darken the bright futures that we promise to build for the next generation. All to give trillion-dollar tax breaks to billionaires like Elon Musk. You know, it's kind of like it's Robin Hood in reverse. Stealing from the poor, giving to the rich. And if billionaires, they don't need another damn tax break. You know, the health, the safety, and the well-being of our children isn't negotiable to me or any of my Democratic colleagues who are here and those who are not here. Why don't Republicans feel the same way? I also think about how these cuts will impact our communities of color. Hispanic households experience food insecurity at more than twice the rate of white households. For African American households, it's nearly 3 times that of white households. SNAP has been an essential program to combat hunger and to provide economic security to our communities, lifting more than 2 million people of color out of poverty in 2023 alone. Republicans are saying we can't afford to fund SNAP. I say we can't afford not to. You know, Medicaid is crucial to providing life-saving health care to communities of color as well. You know, you can't be healthy if you're hungry. Black and Hispanic households enroll in Medicaid at more than twice the rate of white households. Medicaid is responsible for improving health care outcomes for people of color, combating the maternal health crisis, and addressing racial disparities in health care. Simply put, Medicaid is saving lives. Republicans keep talking about making America healthy again. Well, they need to start by leaving Medicaid and SNAP the hell alone, because these programs are building a healthy American. And we know that these programs work. They are essential for providing health care, reducing food insecurity, and building economic security for every American, especially communities of color. But Republicans are prioritizing greed over the need of their constituents. And we cannot stand for it. We're not going to stand for it. We're going to fight this bill in committee. We're going to fight this bill on the floor. And we're going to fight to protect the futures of every single American who will be hurt by these reckless cuts. You know, we've got to continue to fight. We've got to stand up. We got to speak up, and damn it, let's cut up if we have to. But listen, I'm so pleased to be a part of this group and my colleagues who are standing together to make sure that we protect the least, the lost, and the left behind. That is so important. I thank you all, and I thank you, Congresswoman Pressley, so very much for bringing us together. And Color of Change, let's change some things. Thank you.
When we fight, we win. When we fight, we win. When we fight,
we win. When we fight,
we win.
I'm Gabe Amo. I represent Rhode Island's 1st Congressional District, and I am so honored to follow some powerful congresswomen. Can we hear it for them?
Yes.
And look, we know it's the case that budgets are a statement of values.
Yep.
And the partisan bill that House Republicans are trying to force through is a symptom of moral decay.
Yep.
You know, it took 8 days for Neil Armstrong and Buzz Aldrin to land on the moon. It took 52 days for Thomas Jefferson to draft and our founders to sign the Declaration of Independence. And in the 120 days of this horrific Trump 2.0, Republicans concocted a tax scheme that would tax the poorest Americans to give handouts to the rich.
Yep.
Record timing to cause such great harm. And this is moral inversion. It's time for billionaires to pay more, not less. And so we're standing in front of the U.S. Capitol today because we will not stand by and let those on the other side of the aisle gut health care for 13.7 million Americans, school meals for 18.3 million children, food assistance for about 11 million hungry people, and access to higher education for 4 million college aspirants. We know that these cuts will hurt communities of color the hardest. It will make it harder for the single mom who is pursuing college to feed her kids and keep them healthy. It will make it harder for the family recovering from a job loss to feed their kids. It will make it harder for the low-income child to learn as they worry about what they're going to eat for lunch. All of this pain, all of it, is so that the richest Americans can have an extra $82,000. What is that worth this pain?
No.
Absolutely not. Absolutely not. You have more money for billionaires to buy cars, more money for billionaires to buy yachts, while those who are making the least will in fact do what? Pay more. That's crazy. So this budget is wrong. We know it's wrong. Republicans are perverting the promise of America, a promise that says if you work hard, you pay your fair share, we'll give you a hand up if you're having a hard time. Instead, Republicans are prioritizing the well-being of the well-off.
Yep.
They are prioritizing their billionaire buddies like Elon Musk and the crew that pay for entry to 1600 Pennsylvania Avenue. So we have chosen the path that we must choose, which is to stay loud.
There we go.
To educate our communities, to make sure that Americans know the consequences and that Americans know that they have power. We are not powerless. The people in this building do not dictate our futures. It's people in communities across America who must now raise their voices. Do not put the phones down.
Yep.
We know that Republicans need to hear from you.
Yep.
As much as they hear from us, it is far more important they hear from the people they work for in their districts across America. And don't put those phones down. Don't put those phones down. Don't be silent. This is a time to be loud. This ending is not inevitable. It isn't. And so we must fight. We must fight. We must fight. And I am grateful to be fighting with you today because I know that we will win.
Yes.
Victory may be hard earned, but we will win because it is what people are literally depending on. Their lives depend on this mission, and we will save those lives. Thank you.
Thank you. All right. Victory is mine.
Hi, everybody. My name is Michael Linden. I'm the Director of Families Over Billionaires. It is an absolute honor and privilege to be standing here today. It feels a little intimidating to go after such incredible leaders, and I thank you all for your leadership on this incredibly important fight that matters to millions of actual human beings. Sometimes the numbers can obscure the fact that we are talking about families who are struggling, who are just trying to do right by their own communities and their families and their kids, and the folks in the building behind us are coming today and saying you should get a little less so that billionaires can have a lot more. It's wrong, as Congressman Amo just said, and I can't thank you enough for being part of the fight with all of you, and I thank Color of Change in particular. This GOP tax plan, I'm not going to exaggerate. These are numbers that come out from nonpartisan analysts. The average tax break for somebody who makes more than $5 million a year is $400,000. Meanwhile, they are going to increase taxes on the poorest 20% of Americans and take away their health care and take away their food assistance. The Congresswoman said it best. This is reverse Robin Hood. They are taking from the poor to give to the rich. Taking away access to health care and food assistance is incredibly backwards. And it is hard to explain to everyday Americans why somebody would do this. But Republicans say they don't have enough money. We can't afford it. Where'd the money go? Well, maybe it was all the tax breaks we've been giving to rich people for the last 25 years. Then all of a sudden they look in the coffers and they're dry and they say we can't afford health care. While they're giving another tax break. Right now, behind me today, they are pushing another tax break for people at the top. Meanwhile, they are cutting Medicaid. They are cutting food assistance. We learned today that 18 million children could lose access to school meals because of this bill. The impacts will be especially harmful to communities of color. We've heard some of the statistics before, but it's important to remind ourselves these are Americans, these are human beings who rely on these programs to get a leg up, to give their families a better future. 1 in 5 Americans on Medicaid are black. 64% of black mothers give birth using Medicaid that covers that birth. More than half of all black kids in this country rely on Medicaid for basic health care, and those are the things that are being cut in the service of a tax break for rich people. It sounds like hyperbole. It sounds like political rhetoric, but it's not. Read the bill. That's what's in there. But it's not too late to stop this. This bill is not over. It is not done. They have not finished the voting. And I do believe that when the American people speak up, of all political backgrounds, there's a reason this bill has only 14% support among the public. That's bad. 14%, not good. I'm not an expert, but that's pretty bad. And there's a reason. Because it doesn't matter what your political background is. No American thinks it's a good idea to take health care and food away from struggling families to give tax breaks to billionaires. Republicans have tried this before. They did a tax scam in 2017. It was the most unpopular piece of legislation ever enacted into law at that time. And the American people rejected them for it. They will do the same here. Politicians here in Washington fundamentally need to decide whose side they are actually on. Are they on the side of working people who are struggling every day to get by, or are they on the side of billionaires? The next few weeks are going to tell us a lot. Exactly. Thank you all very much.
And so you've heard from many of our Congress people, many of whom had to get back to committee because markup, is starting and they were needed, but want to make some space to share, for our members to share some of their stories. And so I'd like to call to the front David Nolly.
Good afternoon. And talk about intimidation after speaking after so many esteemed members of Congress, including some of the members of the squad. I was a little intimidated at first when they asked me to come up and speak, and then I thought about why I'm here, and that intimidation flew right out the window. I'm standing back there holding a sign that says hands off of SNAP, and I can speak to you from firsthand experience that 64 years ago, my mother was on public assistance, that she needed to raise her 3 children by herself. As you know, hungry children find it hard to succeed in school. Yep. That program helped us survive. It nourished us. It gave us the strength to get through school, and this is what my mother wanted. All 3 of her children graduated high school. 2 of us went to college. We've worked in the insurance industry. We've worked in the service industry. We've been in the military. We've worked in federal service. That shows a generational success for programs like SNAP and like Medicaid. It shows that it is not a handout. It's not even a hand up. It's an investment, not just in my family, but in our communities and in America at large. So I would say to you, let's get behind this effort. Let's get behind this program. Talk to the people that you know. We know that many of the Democrats support this effort. Yes. We know that already. What we're hoping is that we can get out and share this message with others and let them know this is not about a hand up, about an investment in America, an investment in Americans, because we can. Thank you.
Angela Surratt.
When we fight, we win. When we fight, we win. All right. I am honored to be here today. I represent what everyone has been talking about today. It's not just about reps speaking. It's about us, the people, showing up. We are who need this. And the only way we're going to get it is to fight and continue to fight. And to put a face to what you're taking away from. My family starts from the descendants of enslaved people. My grandfather, Avery Surratt, fought in the Vietnam War, World War II, and the Korean War. And while he was away, my grandmother, Ida Mae Surratt, raising 7 children, 7+ grandchildren, was fighting here on these streets for fair housing and health care. So hands off of my Medicaid. Medicaid started being available to us in 1965, which was the year I was born. So, God willing, we both will turn 60 years old today.
There you go. All right.
And it is a program that works. I'm an entrepreneur. I've been responsible for just all of my insurance, unaffordable insurance. So I had to use Medicaid. And I have 2 children, and I had a mother who was ailing. I had to become her partner in caring for her, and Medicaid got us through. That's Medicaid working like it's supposed to work for the people, because we, the people, we pay into Medicaid. My mother paid into it for 40 years. I'm paying into it for 47 plus years. My children are paying into it. I have 5 grandchildren that will be paying into it. And at one point in time, I was kicked off because I made $3 too much. And it wasn't until the Affordable Act came that I could have insurance again. Just a basic need. So I say, this is our money, and I'm not giving it to billionaires.
There you go.
I am the working class. This is not just unjust, it is unjustifiable. When we fight, we win!
And Lakeisha Ashley.
Hello. Oh my gosh, let me get my little notes because I'm long-winded. I'm here today on my graduation day. Thank you. I'm supposed to be graduating from the University of Maryland today with a degree that actually helps me solidify what I've been doing for the last 10 years, which is being a licensed clinical social worker exclusively for Medicaid clients. I only provide the best services needed in mental health care to these communities that are overshadowed, overlooked, and underrepresented always. I come from that background. I was a young mother as well. I had my first son at 20 years old when I was pursuing my first degree. And now, like I said, I'm on my third.
There you go, girl.
Okay, and I'm back, giving back to those communities because I see the hope that every family has. The young mothers who are ailing to survive, the children who are going to school and see me as a representation of them and want to go to college as well. My 18-year-old son is now in college. He is also going into healthcare. He's actually going into education. So we have a legacy and building a legacy of giving back to our communities based on Medicaid and the standards that they say that we don't deserve. But I am here to tell you that we do deserve it. We have to root this in hope, advocacy, and effort. These cuts that are being proposed will tear down everybody. And one thing that I've heard over this lobbying and advocating for everything is that if he can do this to us in the dark, what is he going to do to everybody in the light?
There you go.
Because this is being done behind our backs in every which way, form, or fashion. And right now, this is not a public health issue. This is not even a public policy issue. This is a public safety crisis if these provisions are passed. So I'm coming down from the top to the bottom, from someone with experience and also fighting for justice in our families all over the nation. We cannot let this pass because we will be detrimental to everybody. Thank you.
I want to thank everybody for coming out today. I hope that through our partners on the Hill, through our members, that you all are reminded that we are more than a line item, that we are more than what is in the budget, that we are here on behalf of our families and communities for what is right and what is just. And so thank you all for coming out this afternoon. We appreciate you and hope that everyone is calling their congresspeople, pushing their representatives to vote no. Thank you.
When we fight, we win. When we fight, we win.